Good afternoon and good morning, everyone, and welcome to day 4 of our 2021 National TANF State and Tribal Directors Meeting. Again, I am Lisa Washington Thomas, and I hope that many of you were able to attend our socialize over snacks this morning and play either the TANF trivia or get to know each other in a facilitated discussion. Over this week, you have all shared your passion and commitment to prioritizing the well-being of individuals in your communities. And I like to specifically talk about yesterday and our final panel last night. We heard powerful insights and important recommendations from individuals with lived experiences who received support from human services programs. We heard about their difficulty of accessing benefits, of the importance of empathetic case managers, the opportunities that can open up for families when they receive critical supports like cash assistance, education and training, childcare, and supportive services. As we continue to reflect on yesterday, I'll encourage each of you to write a comment about what challenged you yesterday, based on the conversation yesterday and the challenges that we received from the lived experience experts, what can you do or what are you doing to address some of the concerns that was mutual in each one of our lived experience experts, even though they lived all across the country. And I know what challenged me was to make sure that I am empathetic and that I bring up empathy to people in conversations, so that if someone is maybe being a little harsh or has stricter rules that are over and beyond what is required, to open up the conversation. So I encourage you to put your comments in the chat, and I will share, and we will have share some of the comments that you're writing. And we don't just want to stop there. We're hoping that you continue to reflect on the past 3 days, on what you've learned and how you've been challenged, and what knowledge you will bring back to your communities to better serve your customers. So for right now, I'm going to look in the chat to see what comments are being shared. I might need a little help because I'm having computer problems. Okay, we have one new message that just came up. Steve McLean is working on the chat, and we will have some comments coming up. I also want to talk to you about, while we're waiting for the comments, the chats to come up, I will complete some of the housekeeping items that we need to discuss. So our meeting this week is kind of divided into 2 segments. And the first segment is our typical TANF state and tribal meeting, where we have workshops and we encourage peer engagement. And tomorrow is more like a training, where we'll have representatives from Mathematica telling us about LI squared and having states who have participated in LI squared sharing their experiences. Michelle Dare from Mathematica will be on later today after the plenary to discuss discuss what's going to happen tomorrow and give you a preview. Damon, I'm going to have to ask you to help with the chat. I'm having internet.
I can definitely help you out, Lisa. So we are still transposing, and like Lisa said, we want to hear from you about yesterday's, how you felt after yesterday's moving plenaries, what particular next steps your program or you are interested in making investments in, so that you can improve some of those customer relations, the genuine customer engagement activities. So please drop in the chat some of the thoughts that you had after yesterday and some of the things that you've already started bubbling up in your head. So if you could add them to the QA box over on the scene, that helps. I'm going to call out one of my colleagues. I know that Susan was able to join yesterday while we wait for our state and tribal participants to enter in the chat box. Susan, how did you feel after yesterday's activities?
Thanks, Damon, and welcome everyone again today. Well, it just really struck me how we always need to think about the customer's experience, and that we are there to serve the customer and to make their life easier, not harder, right? And so we really need to be more reasonable in terms of sanctions, requirements, understanding all the multiple things that families have to balance: childcare, works, getting their kids to school, all those things, all those complexities, and sort of really and understanding it even from our own perspective. I mean, we have such privilege, and yet we get stressed by those sorts of things as well. Yet we have so many resources at our fingertips. So I think this notion of empathy that Lisa mentioned, I think, is so important. And and earlier in the day as well, there was another session around sort of how do you have authentic engagement of individuals, and in terms of their voice, and different strategies for that, whether it's in if you're going to have a new policy, let's have an advisory group or a council that can help inform your decision making. So I think it's a real eye opener, I think, for us in the world of TANF and child, because unlike child welfare, where the I think the voice of particularly the foster youth has been something we've heard a lot. And they've been very supportive in helping foster youth to be able to use their voice and have forums to do so. So anyways, I think they were those two sessions were very powerful and really reminded us what we're about. And I think that was great. So thanks, Damon.
Thank you, Susan. And I know that going through COVID with my circle, and we have one comment that came in, so keep them coming. My friends in my immediate circle were talking about how hard it was to work from home and have kids and have kids right there, and you have to watch their homework and monitor their different things. And for them, public transportation was a luxury, not a necessity. So I was only thinking about the types of challenges people who may not have the ability to call childcare at a drop of a hat, or they have a car that's waiting for them if mass transit doesn't go away. So it's really understanding some of those challenges, like you said, Lisa. Brian Blackburn has said, definitely interested in sharing wage information for participants between state and tribal TANF. It would really help with outcome tracking. Thank you, Brian. And from Mika Smith, one takeaway involves lived experience experts in multiple aspects of programming and compensate them adequately for their expertise. Mika, that definitely makes a lot of sense. We were actually in a workshop, I think it was on Tuesday, where people were talking about the compensation that many TANF programs have for their staffs, and reconsidering the types of skills, the types of adequate pay so that they can get through. Sanjay, interested in helping states make the transformation from a compliance model to an empowering model. Oh, wow. Compliance model to an empowering model. Definitely, we've heard that from TANF programs before, moving away from that strict compliance, following through on the work activities and things like that, but actually adding to that with more supports. Babs Roberts out in Washington, wondering if there are examples in state TANF programs for counting the day-to-day management of family and resources as participation. So we're going to throw a question on our state folks. and our tribal folks. Oops, chat's moving fast now. Thank you. Wondering if there are examples in state TANF programs for counting the day-to-day activities, the day-to-day management of family and resources as participation. That would be interesting to hear some folks. So if you have some examples, please drop them into the chat. And I see Susan went off of mute.
Well, only because I'm not absolutely sure whether that would count towards a federal work requirement. But, you know, as we had talked about quite a bit yesterday in yesterday's plenary, many states have a lot of flexibility in terms of what they count and what they allow, independent of what counts in the federal work rate. So I think in that context, for both state and tribal TANF programs, it is certainly possible.
Thank you.
But I would have to double check with my policy experts. But
Thank you, Susan. From Anonymous, what is a challenge in my, now they're coming in too fast. What is a challenge in my state is addressing the disparities in how our customers receive services. The level of service a family receives really depends on what county they live in and what worker they are assigned. State staff frequently deliver messages around empathy, and it's a work in progress. Thank you, Anonymous, for acknowledging that. And if there's ever a time that you're interested in some technical assistance or support, definitely reach out to your regional program office or reach out through the Peer Technical Assistance Network. We may be able to assist you around a few things. Linda Richardson will bring the lived experience session summaries back and discuss how we can incorporate them into our TANF programs. While we have done this on a small level, I see the benefit of making this a formal aspect of the program. Thank you, Linda. That's a great plan. I think we have room for another one coming in. No more? So Susan, none are coming in, so I think I'm turning it over to you to get started with our panel.
Thank you, Damon, and thank you everyone who did respond. And I'm sure there are a lot more thoughts going on about how we really take some of the lessons we learned and the voices we heard yesterday and start to incorporate that into our programs in a meaningful way. So I'm very happy to be moderating this session. This plenary session this afternoon and this morning, depending on where you are. We're calling it ACF Perspectives on the Pandemic and the American Recovery Plan. Over the course of the pandemic, as you know, the federal Congress provided lots of additional funds to assist in recovery, both directly to families as well as to many of our programs and programs really throughout the federal government. At ACF, in the most recent bill, the American Rescue Plan, we actually received $47.5 billion, which is a huge amount. And these funds, they represent the largest infusion of federal resources for families in 60 years to ACF. We believe that they provide an opportunity for states and tribes to develop a comprehensive approach to transform the way we support children and families and address system inequalities. Today, we're going to explore a little bit how you can harness these available resources, if you haven't done so already, and create real and positive changes for Americans who are most in need of emergency relief. And we'll scroll back up a second, Damon, just to see, you'll see where we've got lots of funds. 39 billion came into childcare, and we'll be hearing more about that for both stabilization grants and supplemental CCDF funds. The Office of Community Services received a critical, amount of money, $4.5 billion for the Low-Income Home Energy Assistance Program, and they also received $500 million for a new program. And Lauren Christopher will be talking to us about how that implementation has been rolling out. It's called the Low-Income Household Drinking Water and Wastewater Emergency Assistance Program, but I think we call it LIWAP for short. Am I saying it right? Okay. Next, Damon. The Office of Head Start, another $1 billion so they can reach more families, and obviously very critical during this time. everyone here knows about the Pandemic Emergency Assistance Fund, $1 billion for states, tribes, and territories. The question is really, how do we take this program and our TANF program and coordinate it with these other resources so that families do receive what they need? The Family and Youth Services Bureau received $450 million for family violence prevention and services. We understand the stresses and strains that families encountered during this time, and so these funds helping to deal with that. And is that my last slide? Well, no, there's one more slide. There we go. The Children's Bureau, who administers our foster care and adoption programs, they received $250 million for a community-based child abuse prevention program, and then $100 million for state systems. And then last but not least, the Administration for Native Americans received $20 million investment in the preservation and maintenance of Native languages. And Michelle Sauvé will be talking with us about that and other issues related to Native Americans during this time. So as you can see, there's a lot of money, and not only came into ACF, funds went into other aspects of HHS, into HUD, rental assistance, workforce dollars, education. So, this huge influx of money coming into the states. Yet, as typical of government and Congress and committees and all of that, it really came in silos, right? We all got our extra money in our existing pot, or even having to create a new program. So we know it's a challenge. It's a challenge just to get one program implemented and our new dollars incorporated into your program. But when there's so much going on, it becomes even more challenging. But I do think it's important that we start to think about, how do we blend these funds? How do we, at the state, tribal, local level, how do you think about patching them together, if you will, or braiding them together in a way that does really fulfill the needs of all the families that we serve, and perhaps even transform how we think about serving families. So today, as I mentioned, we have some folks from our sister agencies within the Administration for Children and Families. They're going to talk a little bit about what their office does, what they received, and if they did, with respect to pandemic relief funds, and then also, what role their organization is playing if they didn't receive funds in responding to the pandemic and other emergencies that have occurred during this time. So I'm going to name the speakers right now, but then I will just introduce them prior to each session. Our first speaker will be Byron Mason, who is the Deputy Director of the Office of Human Services Emergency Preparedness and Response, which we call OSEPR for short, thank goodness. Following him, we'll have Lauren Christopher, who is the Director of the Division of Energy Assistance within the Office of Community Services. Then we will have Michelle Sauvé, who is Acting Commissioner for the Administration for Native Americans, which we call ANA. And then finally, Dr. Ruth Friedman will be joining us, and she is the Director of ACF's Office of Child Care. We're going to begin with Byron. As I said, he's the Deputy Director of OSEPR, and he leads ACF's emergency preparedness efforts and coordinates with emergency management, public health, and human service partners to respond to disasters and emergencies. Byron joined OSEPR in 2019 after working at the Division of Recovery in the HHS Office of the Assistant Secretary for Preparedness and Response. Maybe that's called SEPR, I don't know, where he led Health and Human Services recovery operations following Hurricane Sandy, Matthew, Michael, and Maria, the Flint water crisis, and the 2018 California wildfires. I think if there's a disaster, Byron is the man you want with you. He previously worked at FEMA and the National Academy of Sciences, and he was actually formerly a county human services employee in Fulton County, Georgia. So he brings a lot of experience at different levels of government and really working on the ground in terms of responding to natural disasters, and as well as to the pandemic, and as well as to bringing Americans back home when COVID first started, and then more recently, repatriating Americans who have been in Afghanistan. So with that, I'll turn it over to Byron. Thank you.
Thank you, Susan, and good afternoon and good morning to our friends and partners on the West Coast. I am very excited to be with you this afternoon or morning to chat with you just a little bit about the work that OSEPR does, because our work is very much centered on the principle that human services providers, we are emergency managers, we are crisis managers, because we are the ones who are supporting the most vulnerable in our nation every day. So the tagline of supporting people before, during, and after disasters very much applies to us, very much applies to you. And I think you'll see there on that slide, that is a photo of me and my team in our most recent and still ongoing operation as we were welcoming home US citizens who have been evacuated from Afghanistan, had quite the journey and entered the United States at the Philadelphia International Airport. And that mission is still ongoing as we continue to support them. And I'll connect hopefully that work to yours as well, because thanks to the crisis that these individuals are, of course, escaping, many of them are vulnerable, financially unstable, and some may, in fact, need TANF support when they reach their state or territory of final destination. But to circle back really quickly to COVID-19, which I understand is why we're here today, certainly I think the importance of human services has really been evident and highlighted throughout the nation's response to COVID-19 at the federal level, state, tribal, territorial, I think at all levels of government and community. Because this is a public health crisis, I think naturally our partners at the Centers for Disease Control and Prevention have been front and center, but the communities that ACF serves have been the most vulnerable and impacted. So much of the nation is now coming to understand the importance of childcare. And I think we are starting to expand our collective definition of what an essential worker is or who an essential worker is. Many of these people are, I think, as you all know, unsalaried workers who are unable in most cases to work from home and in many cases implement the social distancing recommendations from our public health partners. So really being able to highlight that reality that we as human services providers deal with every day to our public health and our emergency management partners has been, I think, critical in the development and informing many of the acts that have been passed, CARES Act, the American Recovery Plan, the funding that has been pushed out has very much been informed by your experiences that you've shared with ACF across each of its programs, but particularly here in OFA, as we've been able to elevate that and represented in the conversations that we've had with the White House and Congress. So going back, and it does feel as if it was a much longer time than it actually has been. I'm sure we all feel that way. But going back to 2020, at the outset of the pandemic, yes, some of the original, or the first rather, US citizens to be returned from China at the outset of the pandemic, my office, OSEPR, we were the ones who welcomed them as they returned to the United States, initially at the military base in California, and then some of the other installations across the nation, and continue to support them. But here in ACF, OSEPR worked to establish a crisis action team. We took our emergency management principles and tried to kind of, modify them, make them a little more human-centric, if you will, and more human services focused, to really be able to kind of facilitate the coordination across all of ACF's programs to pivot and respond to the pandemic. And a lot of our initial work was focused on identifying the operational impacts to our programs and the communities that we serve, again, so we could put that information in front of our partners at the White House. And again, it was used to inform the public health messaging, particularly the public health messaging that CDC was issuing and disseminating targeted to children and families. And also, I think our involvement and our input has been critical in explaining the gaps in some cases, or rather the challenges in implementing many of the public health interventions that were recommended. So many of our partners on the medical side or health side quickly pivoted to telemedicine as a way to continue to provide health services to their clients and their customers. And it was really important for ACF and through the input that you were providing to note that that isn't just a plug and play solution for human services providers, recognizing that internet bandwidth is not the same across the nation, and many of the families that we serve may not have access to broadband or internet at all, and that the human services service delivery model, particularly in case management, is a model that is face-to-face as you are building those relationships, establishing that trust so that those families can share with you what their needs are. And so that requires a lot of close contact, right? And so how does that intersect with the recommendations to social distance? Also championing the reality that, hey, our staff, our team members, we're also having close contact again with people who may be vulnerable or exposed to COVID-19. So these conversations and discussions about PPE, personal protective equipment, sanitization, ventilation, all of those things need to be informed by how human services providers work and conduct business every day. So all of that information that you did provide through OFA and other ACF programs, again, OSEPA really worked to make sure that we were elevating your concerns and your needs. And I think that is borne out in much of the legislation that has come out over the past year or so. I must note, of course, we are now in the peak of the 2021 Atlantic hurricane season. And so this is the second year for us at OSEPA where COVID-19 has intersected with emergency response, particularly in response to hurricanes and wildfires. So we're actively assessing many of the human services impacts from Hurricane Ida, impacts to communities and human services providers in New York, New Jersey, Louisiana, and Pennsylvania, and all the communities in between. So we're looking again at those operational impacts and the challenges to communities being able to access services. And COVID-19 has very much impacted how we as emergency managers conduct emergency shelters. So in addition to the shelters that our human services providers operate every day, of course, congregate shelters are typically open when there is a hurricane on its way, and the need to continue to social distance has certainly intersected with that. So those are some of the challenges now that we're looking at, is how do we address and support COVID-19, every other emergency that goes on, natural disasters, if you will, and then also intersecting with the personal crises, the family instability that you support every day. So I do want to kind of end just with a quick background on OSEPA's regular missions, if we could call it that. I don't know that any of our missions are ever truly regular, but certainly last year after Hurricane Laura made landfall, we were able to activate our case managers and connected with more than 9,000 disaster survivors who again were being impacted at that time, both by Hurricane Laura, the power outages, disaster displacement, and COVID-19. And we referred them to more than 8,000 resources and providers. And in some cases in past years, we have, and most likely this disaster as well, we have had to refer disaster survivors to TANF administrators for support, as disasters do displace people and they disrupt their financial conditions or situations, if you will. And in many cases, some families that maybe didn't need human services prior to a disaster are now trying to figure that out in the midst of recovering from that disaster. So that can be really challenging. And I think that very much connects to the work we do and the work that you do in trying to explain programs that are often complex. And then to circle back to the first slide, but now the end, Operation Allies Welcome. So that continues to go on. In the last month, we have supported more than 600 families of US citizens who were evacuated from Afghanistan and returned to the United States. And some of those families may be ending up in your communities around the nation. And some of those families may need TANF support after they arrive. One such case is currently ongoing in California, where we have a family of 5 that includes the father who's a US citizen, the mother who's an Afghan national, and their 3 children, the youngest who was just born, and really kind of teasing out which programs, CalWorks, CalFresh, our temporary assistance through our program, which programs are people able to avail themselves of depending on their particular status. So I think I'm on my last slide. Yes, awesome. All right, so there aren't any TANF waiver authorities specifically for disasters, but there are many flexibilities that you can request through your TANF contacts at OFA, particularly the ability to forgive the TANF penalties related to work participation requirements, and the ability of states and tribes to be able to streamline the application process, to expedite TANF eligibility and payment determinations, and as well as for states to implement temporary residency policies. So again, unfortunately, many people are displaced after disaster and arrive in a community that they were not living in prior to that disaster, and they would be needing your support. So I think all of that connects. The work you do every day, which I know you know intimately and well, definitely was pivotal and essential for COVID-19 and continues to be throughout the hurricane and wildfire seasons.
Thank you, Byron. First of all, you did a great job of explaining the TANF policy there at the end. But I also think what really came through is how much communication occurs between OSEPR and all the program offices at ACF in terms of, if there's a natural disaster, or even in the case of COVID, are the offices functioning? Is Head Start still open? Are TANF agencies able to deliver services? That information back and forth really, enables us to know what's going on, for Congress to understand how they might need to respond, or even how, ACF as an agency needs to respond. And so it's a very critical office that Byron is part of. And the other thing we do, we also share staff. We lend staff often when some of these crises and hurricanes and all have required more staffing than OSEPR has, and we often lend staff to either go in person or work virtually. Thank you. I think that was great. It was a great start because it really sort of cast the challenges that have been that we all have confronted as administrators, and even more so providers of services, right? The people that our grantees are the ones that often struggle the most, and that's who, through OSEPR, we learn about where we need to provide support to them. Thank you, Byron. So next we have Lauren Christopher, and as I said, Lauren is the director of the Division of Energy Assistance within the Office of Community Services within ACF. And in addition, let me just say, Office of Community Services administers the Community Action Program as well. But Lauren oversees the administration of the Low-Income Home Energy Assistance Program, LIHEAP, and the Low-Income Household Water Assistance Program, this new program that we're going to learn about. As most of you probably know, LIHEAP is a block grant that provides more than $3 billion in annual funding to federal, to state, territory, and tribal governments to assist families and households with meeting their heating and cooling bills, as well as some for weatherization. LIWAP, you're going to have to tell me, is a formula grant program that is providing more than $1 billion in emergency funding through states, tribes, and territories to assist people with their water and wastewater bills. This is a new program. And I tell you, when the money came down, there's not always a lot of time to implement these programs. But Lauren's going to tell us about what's been going on at OCS. And again, I think it's useful to think about, are we ensuring that our families are receiving these benefits or know how to access them? And at the same time, how can TANF also provide sort of a stopgap, if you will, in some circumstances for these issues. So thank you, Lauren, for joining us today.
Thank you, Susan. I really appreciate that introduction and the invitation to participate today at this meeting. So really glad to be here, albeit virtually. Hope everyone is doing well. So with the next slide, we'll start talking about LIHEAP. As Susan mentioned, it is a block grant program, and it actually reached a milestone this past August 13th. It turned 40 years old, so as a block grant program. So we're very excited about that. And we actually have been using this summer to kick off a year-long national outreach campaign about LIHEAP. As Susan mentioned, LIHEAP assists households that are low income. That exact cutoff will vary depending on the state, tribe, or territory. because again, given the block grant structure, a lot of the key program decisions actually rest with the state, tribe, or territory grantee. And so the federal LIHEAP statute gives a broad range of income eligibility, and the grantees can decide where within that range to actually set the income cutoff for their state or service area. And so at the broadest level, the highest the income can be for a household, not just family, but a household, which basically is any group of people living together in the same unit that are being served by the same home energy source. So they're all on the same bill for heating or cooling. So on the household basis, the greater of 150% of federal poverty guidelines or 60% of state median income. And the cutoff cannot be any lower than 110% of the federal poverty guidelines. So exactly where it falls, again, will vary state by state. Now, remember, we have 206 LIHEAP grantees. All of the states, the District of Columbia, 5 territories, and 150 tribal governments or consortia are directly funded by ACF. The tribes that do not apply directly are serviced through their respective state counterpart programs. So the last time we reached this sort of level of funding goes back a little over 10 years. So 2009 to 2010 was when we reached our previous historic high of just regular funding of $5.1 billion, B like boy. And then it kind of dipped a little bit into the low 4 billion range. And then we've kind of hovered for the last number of years in that mid to high $3 billion range. But 2021 really was a game changer with the influx of the American Rescue Plan, the ARP money. It actually exceeded the regular funding we got under the 2021 budget. So we got 3.7 billion from the 2021 budget, and then the 4.5 billion from the ARP. So $8.2 billion to use for LIHEAP. Now, with our regular budget, usually grantees need to obligate or legally commit those dollars, 90% of it, by that same federal fiscal year. So remembering the federal fiscal year runs October 1st through September 30th. So by this September 30th, next week, 90% of that $3.7 billion has to be obligated. But they have a little longer to obligate the ARP LIHEAP money. They have another year till September 30th, 2022. Now, what obligation looks like in any particular state varies by the state's definition of obligation. So that might include entering into a sub-agreement with a local intake agency. For example, it might be a community action agency, another nonprofit organization, or even a city or county government. And so those sub-agreements typically are written for about 12 months, and they might be executed this month, and then the performance period runs for the next year. So the obligation occurs now when they enter into that agreement, and then they're expending out on that as the intake agency actually takes those applications and decides, yes, this household's eligible, and this is how much assistance they can get. Speaking of assistance, remember, again, another area of flexibility for the states is deciding what types of LIHEAP assistance to offer, and even how much of the bill payment they're going to give. So when I think about component types, they have to offer at least crisis intervention assistance through at least March 15th of each year. They can also offer additional heating services, and as well as cooling assistance, and even weatherization assistance to help make the home more energy efficient. They can also pay to buy or repair the home heating or cooling equipment for the household, if that's a problem for why they're not getting the services they need. And a portion of the dollars go to basically holistic case management and client education. So whether that's financial coaching, helping the household develop a budget, helping negotiate affordable payment plans with the utility company, doing referrals with other programs such as TANF. These are all allowable uses of LIHEAP. And again, exactly how much financial assistance a household gets will vary depending on what benefit range the state or tribe is setting. There's no federal minimum or maximum for the amount of assistance that household can get. There is a requirement that the assistance be prioritized for households that have the most immediate and highest need for home energy assistance. And so typically we talk about that in the context of home energy burden, meaning how much of the household's income is really going towards the heating and cooling services for that household. What's that percentage? And how do we bring that percentage down to a more affordable portion of the household income? So really targeting those really high burden households first and giving them more of a benefit to bring that burden down. So lots of flexibilities, and grantees, they submit one plan every September 1st. We are in the process of reviewing their plans for the coming fiscal year 2022. They can change their program throughout the year and often have to do, just like they did over the past year and a half with the pandemic. Or if I even think back to 2014, there was a propane crisis where it was hard actually shipping the propane across country, and there were price spikes. And so grantees had to make really quick adjustments to allow for higher benefit amounts, increase eligibility, so on and so forth. And they can do that. They don't need any prior approval from us to do that. So just remember, the bottom line with LIHEAP is really the states, the tribes, the territories are in the driver's seat, really deciding most of those key program implementation decisions. And so the other thing I would point out is that with the ARP money, there were no special restrictions. They're just supposed to use it under the normal LIHEAP rules, other than that they have through next September to obligate all of those funds. One thing I want to point out is that whether we realize it or not, there is actually quite a bit of overlap with TANF and LIHEAP. And so it's actually written into the LIHEAP statute that aside from income eligibility, the LIHEAP grantees can choose to deem a household eligible for the program just on the basis of categorical eligibility, meaning someone in that household is already receiving another qualifying form of public assistance, and TANF is one of those. So if the state chooses to make TANF an allowable source of categorical eligibility, the LIHEAP intake worker does not have to repeat that income eligibility process or calculation. They can just somehow confirm that that household member is receiving TANF, and then they move on to, okay, how much LIHEAP assistance should they get? So it both streamlines the administrative process for the intake person, but also for the household and usually what they have to provide in supporting documentation. So there's that area of coordination. But also you might recall that TANF has a broad category of allowable costs known as non-recurrent short-term expenses. And so that might include some sort of emergency utility assistance. And so I would assume that would mean typically a household that is currently disconnected from their heating or cooling service, or maybe they have a disconnection notice pending and are about to be shut off because of non-payment. And so you might be able to coordinate or braid some of your TANF resources with the LIHEAP resources to resolve that past due amount or that arrearage in order to restore the services or prevent the disconnection. So really using those case management opportunities holistically to figure out all the different federal resources that could be combined for a single household, so that overall we're making sure the intervention is successful. No one's dying or getting seriously ill in their own home because they lack proper heat or cooling services. So let me pause on LIHEAP for now and switch to LIWAP, our new program. As Susan said, this was sort of a Christmas present to all of us. Congress established the program on December 27th, 2020, and it really was born out of the pandemic and these unprecedented water arrearages that were starting to accrue as people were losing their jobs or seeing reductions in their wages and falling behind on their home water bills or their wastewater bills. And so ACF worked really, really hard. It was an all hands on deck 24/7. Frankly, it's still in that mode of standing up this program as quickly as possible. There was very broad direction from Congress in the legislation regarding how to set up the program. But basically, Congress said, do it as quickly as possible and use any existing policies and procedures that you can. And so we largely modeled the LIWAP water program on the LIHEAP program. Obviously, they're not both block grants. LIHEAP is the block grant. LIWAP is more of just a formula program. So we were able to make a few more directives at the federal level. The key one being we set a national standard for both the obligation deadline and the expenditure deadline. So for the water program, as Susan mentioned, $500 million of ARP money. They have through federal fiscal year 2023, September 30th, 2023, to legally commit those dollars. And then they have 90 calendar days after the close of that fiscal year to pay out or liquidate those obligations. So by the end of calendar year 2023, all of that ARP water money should be fully spent. Again, the same issue I mentioned with LIHEAP in terms of braiding with TANF, that whole issue with non-recurrent short-term expenses applies with water. And it's really important in the water context because water, the congressional legislation required that the bill payment assistance go directly to the water or wastewater company on behalf of the household. And so that had a few implications. One, households that are served by private wells or private septic systems really aren't qualifying for the new water assistance. So that's one exclusion. And two, there's no provision in the legislation regarding helping with infrastructure or the plumbing of the household. So if part of the reason why their home water service is shut off or their sewer system is shut off is related to that plumbing or infrastructure, that's something this water program cannot help with. But there are other federal resources that can help. For example, OCS also administers the Community Services Block Grant Program, CSBG, and CSBG allows for not large scale, but some small scale investments in some of those household fixtures. If you have a leaking toilet or a shower head, things of that nature, or you need to install a filter to remove contamination in the drinking water, all those kinds of things might be allowable through CSBG. And so again, we're really encouraging those at the state and local level to be thinking about CSBG, TANF, LIHEAP, LIWAP to really figure out how are we meeting this household's utility services and still staying within these different federal program parameters. So I would just maybe close this section by emphasizing that well, also like with LIHEAP, the water program encourages the grantees to be doing categorical eligibility, including with LIHEAP, and TANF is an option as well. In terms of a coordinated state approach, I would say that, again, with TANF, there are opportunities for trying to streamline the application process potentially so that we're reducing households having to give multiple applications or the same supporting documentation over and over again, really thinking about these coordinated referrals through case management at the intake level, data verification, so that if LIHEAP or LIWAP is trying to confirm if a household receives TANF, that they're able to have that process with the state TANF office to try to reduce that burden on the household for supporting documentation. So really sharing that information regarding income eligibility. Targeted outreach, I mentioned that outreach is a big deal for us right now, both for LIHEAP, trying to make sure that we're reaching all these newly eligible households that before really weren't on public assistance. So they may not know about the program. They may not be aware of how to apply for the program. They also may be feeling a stigma to applying for public assistance. And so how do we move past that and actually get them served? Hopefully it's just a short-term stopgap measure, but get them as part of the into the fold with the service. And then looking for other opportunities for statewide outreach through our stakeholder organizations like the statewide water vendor associations or the community action associations, which again are a big player in the local intake of both programs. So I'll pause there. And Susan, did you have any questions or clarifications you needed?
That was great, absolutely great, Lauren, and just the connections that you've already started to make between TANF and LIHEAP and LIWAP and CSBG. It also struck me, so often we hear about why it's sometimes difficult to integrate programs or coordinate. TANF has families, it has to be an adult with a dependent child or child only. you are using households. Fortunately, I think for you all, the income level, it goes up to, I think you said 150% to poverty, roughly, or some percentage of the state median. TANF benefit levels or eligibility are so much lower than that, which is why the categorical eligibility would work. I think that was really helpful and very clear. I think we'll hold off on questions for now and move on to Michelle Sauvé. So Michelle is currently the acting commissioner for the Administration for Native Americans within ACF. For those of you who are not as familiar with ANA, it promotes self-sufficiency for Native Americans by providing discretionary grant funding for community-based projects, as well as training and technical assistance. Michelle is also an enrolled member of the St. Regis Mohawk tribe. She, as acting commissioner, Michelle oversees the discretionary funding program to American Indians, Alaska Natives, Native Hawaiians, and Pacific Islanders. She serves as an advocate for Native Americans and coordinates within HHS to develop policies, programs, and budgets affecting Native Americans. So again, within ACF, we have quite a collaboration, an ongoing collaboration with ANA and other offices with programs that serve tribes. As acting commissioner, Michelle also serves in the dual role of the Deputy Assistant Secretary for Native American Affairs, affirming the government-to-government relationship between ACF and Indian tribes. Michelle, thank you for joining us today.
Great. Yawangoa, Susan, Segos, Ganagoagal, Michelle Sauvé Yanyat, Waganasio, Danon, Kaniagahaga, Niwagoa Joran. Just introduce myself in my Mohawk language, and I'm here to talk about some of the things we saw through the ANA lens as Native communities were going through the pandemic. And I think Susan elucidated quite well the various touch points that we have at ANA. So we run our own discretionary grant program. So we had our grantees experiencing, the pandemic directly, and our program specialists working with them to keep their projects going. But in addition, as the acting Deputy Assistant Secretary for Native American Affairs, when some of these new ARP fundings were coming to ACF, we were working to help coordinate tribal consultation to get input on how these new programs could be administered equitably. And through our participation across HHS, we were able to work with operating divisions like the Indian Health Service and the CDC, SAMHSA, and the Administration for Community Living to address some of the broader issues that were impacting not only tribes, but Native peoples in urban areas and our Native Hawaiian and Pacific Indigenous relatives as well, because ANA has a broad mandate in terms of what we determine as Native American. So since this is about experiencing what the experience has been going through COVID, I want to take a moment to pause and just acknowledge the great trauma, not just to Native communities, but to everyone across the country going through this. Those that have lost relatives and those who are just missing. Sorry. Obviously, we are not through this, right? So one of the reasons that this has been so traumatic for Native communities are the very high rates of deaths that were experienced in tribal communities. This was attributable to a lot of the social and economic circumstances that pre-existed the pandemic. Issues like Lauren brought up, where there might not be running water or electricity in the community. So there were challenges already to accessing some important safety net services. And In addition, a lot of the rural communities have very low broadband and internet access. So when we had to pivot to schooling at home, or whether you're doing, high school or job training, whatever, that might not be a realistic possibility for you. And we heard about, students at tribal colleges going to the parking lot, driving 35, 40 miles one way to the community college just so they could access internet and complete and to make progress on their classes and degrees, because it just was not going to be possible in their own home. So there are endless stories like that about the impact that our communities faced. And for our grantees, many of them closed down. So that really put their projects, on pause for a bit. And then they thought about what they could do, because ANA, unlike Head Start or some of the other ACF programs, we fund discrete projects. They're from 1 to 5 years. And when those projects end, the funding goes away and they have to reapply to ANA. So this is their shot. The grants they have from us is their shot to complete that project. So while we did extend flexibilities, like extending the grant terms and allowing for, no cost extensions, there are still challenges, even with that, to completing their vision. So sometimes the projects suffered, but sometimes there were innovations and they were able to reach community or do more. And I'll give a specific example. So let's say that this project was to do train native language teachers that work in the Head Start program. So with the Head Starts not in operation, they might not have been able to work in the classroom with those teachers, but they may have been able to work with the teachers kind of asynchronously to develop more curriculum resources to use when they came back in the classroom. So they thought about, how do we address these serious broadband challenges? Because they're not going to be able to, be on a Zoom and do their lessons for 2 hours because they just don't have the broadband. But they worked it out, and we're just, emailing and finding workarounds to a lot of these things. So while there were so many challenging situations, we did see a lot of innovations. And when some of our language programs, for example, took their services online, they were able to reach people who were outside of sort of a local area. And so community members, people like me who don't live on the reservation or in my tribal community, I was able to access language and culture classes, which I wouldn't have had access to living in Washington, D.C. So there were definitely a lot of trauma, but a lot of possibilities as well. And I think we're continuing to think through, how do we build on the successes and continue to think about innovating and bringing in the opportunities that we found, as well as really working hard to maintain and build back what we might have lost. So I'll say, we've heard stories about, the together time in the home, because a lot of tribal nations took that stay-at-home order very seriously, and some even closed off the community, and you had to ask to gain access to the community if you did not live there, because they knew that with such tight-knit relationships and with families sometimes doubling up in homes, that social distancing, having to drive long distances into town to get groceries, that's a risk factor because you could pick up COVID and bring it back into your community. So there were a lot of factors, and I think we're going to be working through building back and healing for quite some time. And through this, because of the way COVID hit and who it harmed the most, with it being elders and those with underlying medical conditions, the elders in our community are typically the most fluent speakers of our native languages. So losing them is like losing, libraries of information. So we, as Susan noted at the beginning of this session, we did receive $20 million as an emergency Native Language Award. So like PEACE and LIWAP, this Native Language Emergency Funding was not a supplement. We had to come up with a way to distribute it. And typically we are supporting, we give out $13 million a year, typically to Native languages on a competitive basis. Because of the American Rescue Plan, we received $20 million and we did not have to compete it. And if we did, we would not have met the 6-month deadline that Congress gave us to put the money out the door. So we did tribal consultation and we asked, how can we equitably put this money out? There are 574 federally recognized tribes. There are about 60 state recognized tribes. There are Native Hawaiians and Pacific Islanders with their native languages that we are authorized to serve and support the preservation of their languages as well. How do we distribute that money when you have, Cherokee Nation, Navajo Nation with 400,000 members and small communities with, maybe 50 to 150 people in an Alaskan village? So the consultation process was very important for that. And knowing that no one language deserves to be saved more than another just because they have a bigger population, right? All of these languages are sacred. So I'm happy to say that we did get that money out the door by Congress's deadline of September 7th. And we just launched our ARP grants website, so you can find out a little bit about that program if you go to the ANA site. But I also want to talk about some of the other partnerships we did across ACF and with the Administration for Community Living and USDA. And this was to answer a request through tribal consultation raised on food security. So particularly very early on in Alaska, they, even before they were experiencing COVID in their communities, their experience with the Spanish flu told them that if COVID reached their communities, it would be devastating. So they wanted to do whatever they could to not, to keep people out, stay safe. But some of these small villages, the only way they get food is on planes or barges because they're not on a road system. And so there were very significant food challenges, food security issues during the pandemic. And so we worked together to identify all of those different programs across ACF and ACL and ANA and USDA that could be used to support either food sovereignty or food security. So either ways to get foods to vulnerable families and elders, and ways that communities themselves could create more traditional and local food resources that they wouldn't have to be dependent on, that next flight in or the barge if it's in the summer for those Alaska villages. So I just wanted to share because we have these resources. You can see the link at the top for our 2021 food sovereignty. We did a webinar. We featured several tribal communities that explained how they were using these funds in very creative, very innovative ways. Everything, working with their preschoolers to teach them about traditional and native foods, to making sure that elders had access to foods as well. So definitely a lot of wonderful resources here. And so I just wanted to say, while it's been really challenging, we have tried to find opportunities to build up collaboration and identify bright spots. And I would be remiss if I didn't mention, our ongoing efforts to address the missing and murdered Indigenous persons crisis. We were really working on this like full steam when COVID hit, and we asked our tribal advisory committee, because as I mentioned, tribes are going through a lot. Should we continue all of our activities on this? And they said, yes, absolutely. They have been waiting too long for the federal government to take this seriously. And so we did. We once again worked across ACF, all of the program offices, to identify resources to not just respond, but to take a look at what might make individuals vulnerable to MMIP, and then look towards ways to prevent it in the future. So we do have a public health framework on the ACF website, and we are working on an ACF implementation plan for that framework. And so I just want to say that, despite everything, we are stronger together when we collaborate and coordinate. And that goes not just for us here in the federal government, but with the tribal and state TANF programs that are in the audience today. So thanks for the time to share.
Thank you, Michelle. And, really struck by the importance of broadband access, right? And not just, particularly for Native populations, but many of our families across the country in rural areas, and even in urban areas when they couldn't afford it. And I also, what also struck me as we talked about authentic engagement of the families and the people we serve, tribal consultation has been a long practice, I believe, and taken very seriously. And it may be a model for some of us to think about. So thank you, Michelle. Our next speaker, our final speaker, is Dr. Ruth Friedman. Thank you for joining us today. I think we pulled her away from another meeting. Dr. Friedman is the director of ACF's Office of Child Care. She was previously a child and family policy consultant, including work as a senior advisor to the ACF's Office of Head Start, and worked on the development of Head Start's Early Learning Outcomes Framework and overhaul of the program. Dr. Friedman has also served as the executive director of the National Child Abuse Coalition and was the director of education policy at the U.S. House of Representatives Committee on Education and Labor. I'm sure that was a very challenging position as well. There, she led numerous early childhood initiatives, including the 2007 Head Start reauthorization law, plus childcare, pre-kindergarten, and home visiting legislation. As I noted earlier, Head Start, childcare received a significant amount of money, and we know its importance because so much of our ability of our families to get back to work is going to depend on really reinvigorating the childcare infrastructure. So, Dr. Friedman, thank you for joining us today, and we look forward to your comments.
Thank you. My pleasure to be here. Thanks for having me. So my plan today is just to give you an overview of all the exciting happenings in the world of childcare right now. The pandemic hit the childcare sector incredibly hard, as it did many sectors, but for a sector that really lives on razor-thin margins, the and the types of movement that went with closures and under enrollment, challenges around staff health, and of course, kids under 5, I think, are a ways off from being eligible for a vaccine, so safety challenges continue in childcare programs. It has been a particularly difficult time for the childcare sector, and recognizing that Congress and the President invested unprecedented amounts of money to try to save childcare and to get childcare providers the help that they need during this time, as well as expand assistance to more families, because assistance for childcare is so important. And currently, or prior to the COVID money, only about 14% of all federally eligible children receive assistance because of lack of funding in the child care program. So normally what we're looking at with the federal child care is a $9 billion program. We sometimes refer to it as Child Care and Development Fund. Obviously, sometimes we also say Child Care and Development Block Grant. Those two things are pretty interchangeable for our purposes today. And that's a system that largely just provides vouchers for low-income working families to subsidize the cost of care. The CARES bill in March of last year and the CURSA bill in December of last year added $13.5 billion into CCDF to prevent, prepare, and respond to COVID-19. And the ARP Act, which passed in March of this year, added another $39 billion, and that included a $24 billion stabilization program, which is a brand new program. Unlike CCDF, the underlying program, which really is a program that goes from states to support families, this is a program directly to child care providers to try to help them recover from the pandemic and what it has done to the market. And in addition, Arpa also provided $15 billion in CCDF supplemental funding, which can go to essential workers, but otherwise generally is for the same purposes as the underlying federal child care program. You can hit the next slide. So all of these pots of money have different timelines around them. States have another year to obligate CURSA and Arpa stabilization and 2 more years to spend it. And states have another 2 years to obligate their Arpa supplemental funds and 3 more years to spend it. We have heard that states actually started spending childcare with some of their more flexible non-childcare specific dollars in CARES and CURSA because their timelines were a little bit smaller. And so we have seen a little bit less drawdown from some of these pots still as states make their way to them. Next slide. The administration's goals for the COVID childcare funding are sort of run the gambit because we are in such a critical moment for supporting children, families, and childcare providers. First and foremost, as I mentioned, there's just this huge need to stabilize the childcare sector. Many childcare programs closed during the pandemic and were unable to open. Others had to take on a lot of debt in order to keep their doors open and serving families. And it continues to be a struggle. There's a teacher shortage in childcare right now, just like there is a workforce shortage in other industries as well. And that has meant some programs are not able to enroll as many children as they normally are because they don't have the staff to cover it. Increasing provider payment rates to cover the cost of quality is a huge priority for this administration. Right now, the way the underlying child care law works is states set rates that are well below the market rate. And the market rate in child care, of course, is not a good proxy for what child care actually costs to deliver. It's a constrained cost of what parents can pay. And one of the reasons why the childcare sector is so wobbly to begin with. So increasing those provider payment rates is a high priority for this administration. Improving payment policies, likewise, is really important. Most states historically have paid providers based on attendance, child attendance, and not on child enrollment. But childcare costs are fixed costs based on things that don't have to do with one child's attendance during the week. And so moving to better payment policies is really another piece of stabilizing the sector. Increasing wages and benefits of the childcare workforce is also a key priority for this administration. The childcare workforce does essential and skilled work, and they are one of the most underpaid workforces around. We also really need to build the supply of childcare for underserved populations. Of course, there are childcare deserts throughout the country where families just cannot find childcare. There is not enough out there. There's not enough supply to meet the demand. And so our hope for some of these funds is for states to intentionally work on building up the supply of childcare. And then finally, but certainly not least, expanding access to childcare assistance for more families. Childcare costs are a really difficult strain on family budgets, and the lack of money for childcare can force people out of the workforce. It can put families on much more rocky ground. And so we really do need to aggressively move to make sure more families are getting childcare assistance. Next slide. So the Arpa Stabilization Funds, which is the $24 billion new program that has been stood up just since March, quite a bit of work, both here at HHS, but certainly also for states. It really is very different than the underlying federal child care program. States are allowed to set aside up to 10% for administration, TA, and supply building. Tribes are able to set aside up to 20%. And the remaining funds must go to subgrants to qualified child care providers. And they can use that money to towards rent, utilities, personnel costs, minor adaptations they need to make to their programs, cleaning supplies, additional training. It's quite flexible money, and states are the ones who design the program. It's meant to be monthly over a course of time in order to really set providers up in a better situation. Next slide. And as I mentioned before, the supplemental, so that's the $15 billion pot that came in ARPA, really acts just like the current CCDF funds. There are no way, these funds are not related or limited by COVID-19 expenses. And we are really encouraging states to use these funds to strengthen the child care system as well as expanding access. You can move to the next slide. So we have 17 lead agencies, which is 16 states and 1 territory, that have released and have their stabilization grant applications running. We have tens of thousands of applications from providers have come in. The grants are very substantial in size, which is what we had intended. And many states are structuring their grants so that providers get extra money if they increase wages for staff. That is great news, of course. The Navy states there are ones who do not have their stabilization grants up and running yet, but we actually expect 21 more states to come online by the end of October. So we are really hopeful that those monies will start funding. To give you an idea of the ranges of stabilization grants for large centers, many states are setting grant amounts between $30,000 and $60,000 a month. So it is really a substantial amount of money, and important that it is getting out to providers. Next slide. States are also using their ARPA money to increase provider payment rates, which is really essential. You'll see on this slide here a bunch of percentiles. States actually are only required to make sure that what they set provides equal access to childcare for families who use subsidy as for families who do not use subsidy, because CCDBG is a block grant. This has been an area where states have been given wide discretion. HHS has long recommended that states set their rates at the 75th percentile of the market rate. Unfortunately, states have long set it much lower, but we are starting to see some progress with this money, which is really good news. When you have low payment rates, it undercuts the quality of childcare, it undercuts how much childcare exists in a community, and it certainly undercuts parents' ability to choose childcare that meets the needs of their family and of their child's development. So we have some states who are making really important progress with this money. This will have really strong ripple effects, again, for children, for families, and for the providers. You can go to the next slide. And then we also have states using this money to raise income thresholds. The way CCDBG works, of course, is there is a federal ceiling on income eligibility, but most states set their eligibility lower because there is not enough money to cover all families who are eligible. So we are seeing 21 states and territories increase their income thresholds, which is great news. And even those who are not are doing things like expanding out and able to clear the waiting lists they have in their states. And based on very, very preliminary data, so it's not even coming from a majority of states. Right now, it's looking like we will have more than 300,000 additional children served next year as a result of this money. And again, that's an underestimate. States are also choosing really important policies like waiving family co-pays, which is really important at such an uncertain time. And then next slide, I will just close by saying that this is a lot of work for states. Not only is it a brand new $24 billion program that they've been asked to set up in just a matter of a few months, because of the urgency of the situation, but they have 5 times the amount of childcare funding that they usually do. We have strongly encouraged states to use some of this money to increase their own administrative capacity. Unfortunately, many states are choosing right now to continue to implement 5 times the amount of normal money and stand up a new program, and doing it with the same amount of staff that they had prior to this. It's really hard, we think, to meet the needs of kids and families and the childcare providers without making some internal investments within the state to help with strong administration. And we have really encouraged states to do that. We have ongoing TA efforts. We have a number of national TA centers, which we attempt to be as responsive as possible to states' emerging needs, and always ask for states to please reach out with questions and any areas they may need assistance with. And we have also started office hours, which allows a standing time for state administrators to come in and ask questions of OCC in case they have specific questions. So I will stop there. I know we're at time, and thank you for the opportunity to present on this today.
Thank you, Dr. Friedman. And we're gonna move to the sort of some Q&A. And actually, I'm gonna pose one to you first, Dr. Friedman. Earlier, for example, Lauren talked about how LIHEAP and LIWAP and TANF can connect. I'm wondering, given the investment, particularly in the stabilization aspect of really, the infrastructure of childcare, the childcare wages really as a career, do you think this is creating new opportunities, for example, for TANF participants to become trained and become childcare workers or providers, and how might TANF and the TANF agency connect to that opportunity?
So I certainly think that, I mean, the good news about it is that because historically childcare has been so underfunded, there are literally millions of families who have been income eligible for the program but have not been able to benefit. And we know that childcare assistance is so incredibly important for folks who are trying to get back to work or stay in stable employment. And so aggressively reaching out to families who have who were perhaps previously eligible under state rules but not able to receive a child care subsidy because there was not enough money. The situation has really changed on that, and I think it is really important for states to be moving aggressively to help make sure the folks that they are trying to get back in the workplace have the child care, stable child care that they need.
Thank you. As we all know, ACF really has committed strongly to the principles in the executive order on advancing racial equity and support for underserved communities through the federal government. So I'm wondering if you all have thought a bit about how the programs you've talked about, or how your office is taking that on, and particularly do the new funds you've received, for example, enable you to foster greater racial equity? And have you thought about that as you rolled out the programs, and even, you know, whether it be in your communications to the grantees or just, you know, within your office, how you think about it? If anyone wants to jump in first.
I can go first, Susan. I kind of touched briefly on it. For our ARP funding that was specific to Native languages, you know, we knew that there were languages out there that were in small communities that just did not have the capacity to do a competitive application. They didn't have paid staff. You know, writing a federal grant is really hard work, even though we do offer training and technical assistance for all of our funding. So that was one of the reasons why it was really important that we were able to put this out non-competitively. And we also really made a strong push to try to reach communities that we hadn't funded before, just through continuous outreach. So, you know, we're going to be, we have 210 new grants, and it's in 32 states and 3 territories, and we're going to be supporting over 130 languages. So that's definitely unprecedented amount of equity for us. Our resources are typically very scarce and hard to get.
Thank you. Lauren, any thoughts there? Maybe it's sort of how the funds are being delivered at the local level.
Yeah, I mean, for water, you know, the grants, the program is really just launching at the grantee and sub-grantee level. We do know of several states that officially opened back around September 1st, thereabouts, like Wisconsin and a few other places. Other places might be a little slower, but we've been trying to encourage the LIWEP grantees to have a phased-in launch of their water program, because one big part of setting up that type of program is actually not just having the agreements in place with the local intake agencies, but also having agreements in place with the water companies or the wastewater companies, and making sure that they are going to properly credit households' accounts in the right amount, make sure they're restoring services promptly, we're avoiding those disconnections, canceling those disconnections. And so really having adequate consumer protections in place. So, you know, we're really just starting, you know, we're talking more than 50,000 water providers nationwide that we anticipate some involvement with the water program. And so we are encouraging the grantees to really have this phased in approach to the program. And as they are executing those agreements with the vendors, to then start processing applications in that area. So I think really for water, it's about really good communication at that state level or tribal level or territory level about what service areas, what providers are currently in the program, making sure we understand how much money the state or tribe might be reserving for service areas that we currently don't have an agreement in place with their water providers, so that eventually those households can still get served once those water providers come on board. With LIHEAP, the good news was, with ARP, it's fairly seamless in terms of the infrastructure is already there. Those vendor agreements with those heating and cooling providers already exist. The relationships with the local intake agencies already exist. So again, it's really, I think, trying to take advantage of these categorical eligibility processes. You mentioned earlier about TANF targeting households with families. And I would say that for both LIHEAP and LIWAP, it is a requirement to be targeting vulnerable members, vulnerable households, which in these program rules for us means someone who's either a senior, 60 years or older, a young child who is 5 years or younger, or someone with a disability. And so there's definitely overlap there with the young child aspect, or as we even see these multi-generational households potentially, if they're still working into their senior years. So I think if we can think of ways that we can get these state and local TANF and LIHEAP and LIWAP providers having opportunities to communicate on a regular basis. I mean, you see for LIHEAP in particular, we've only got about 1 year to use that ARP money. So getting any feedback we can from the TANF side about how we target these resources will be really, really helpful as we go into the fall winter heating season.
Thank you. And Byron, I don't know if you have comments. Certainly, natural disasters often disparately impact very poor people, people of color. I don't know if you have any observations or thoughts about how OSEPA responds and with that in mind.
So I would say a lot of our focus in the past few months on the equity side has really been to kind of take the work that we do here and educate our partners at FEMA. So some of that, in the past, when there's a declaration, they really haven't really factored in the communities that we serve, don't necessarily have, titles and deeds to their properties due to historical reasons for that. They may not necessarily have, pay stubs and insurance records that they're able to provide a FEMA disaster assistance employee to actually document their loss. And they may not actually own the dwelling that they're living in. So we're really we didn't receive any funding, of course, from ARP, but I think a lot of it is just taking your work and explaining this to the emergency managers who don't have that cultural context, if you will.
Thank you. We're actually just about out of time, and we wanted to allow a little bit of time for a preview of tomorrow. But, one of the things that just strikes me, we've heard a lot of information and a lot of different programs and opportunities. And, how do you get connected to these things? And so I do think, if there's some sort of, whether it's formal or informal, coordinating body in your state that is looking at all these funds and how they can be, not just these funds, but like, HUD and education and just lots of money, finding out if that exists and trying to become part of it, I think is an important thing to think about. And even, of course, at the very basic level, if you will, reach out to your child care agency, reach out to LIHEAP and start making those connections, because it's a real opportunity to, for one thing, avoid redundancy, target funds where they're needed most, shift funds around a bit, and all of those considerations I think are really important that we undertake right now. So anyways, I want to thank all of our presenters, and I think Dr. Friedman had to leave already. But I know I learned a tremendous amount, and I also know of the incredible hard work it takes to get these funds out the door, to get things up and running, particularly when we have some very new and complex programs. I think that whole connection with the water providers, I mean, it's not just, here's a subsidy to the family. It gets much more complicated. And so I certainly appreciate that. I know within PEEF, we've sort of given the advice with our funds, the TANF Pandemic and Emergency Assistance Funds, to make it as simple as possible, give out cash. But you all don't have necessarily that luxury to make it that simple. And I certainly commend all the hard work that you all have done. So thank you for joining us today. And I look forward to more conversations and keeping up with what you all are doing. So with that, I think I'm turning it over to Michelle Dare, who is going to get us excited about partly what she's heard and what's going on tomorrow. So thank you, Michelle. And again, thank you to our great panel.
Yeah, I echo that. Super interesting to sit and listen in. So let me just give you a quick preview of tomorrow. For those of you who don't know me, I describe myself as a researcher gone rogue. I'm absolutely passionate about bringing research and practice together. And one of our important partners in this work has been OFA, particularly under a project called Project Improve. So tomorrow, we also work in partnership, Project Improve on the OFA side, and then another project out of the research side of OPRE focuses, it's called Spark. So tomorrow, what we're going to do is hear about how states and localities have taken the pandemic, the opportunities available through the pandemic to restart their programs, and even before the pandemic as well, to under Project Improve and Spark, to ignite their programs and try innovative science, evidence-informed practices. And so tomorrow, what we're going to start with is a plenary session to kick off and say what is possible in terms of program change in a post-pandemic world and in the pandemic world as well. And so we'll kick it off with Lisa Washington Thomas is going to kind of lead it off, and then I'm going to give some really concrete suggestions for what's possible, very short. And then what's really cool is we're going to kick it off into a series of speed sessions that include our Improve and Spark sites. So we'll have a series of 2 different tracks, 4 sessions in each track. One track is focused on leadership. The other track is focused on practice. We'll have 2 of our sites from each of those, and they're teams that are just going to share with people, with you guys and others who join, their experience implementing concrete evidence-informed practices. We've got things like advancing leaders of color. We've got sessions on developing a supervision practice and implementing a supervision practice, engaging orientation sessions, replacing client assessments with more motivating and meaningful conversations, and also evidence-driven decision making. So that's just a little flavor of what's on tap for tomorrow. And then we'll end the day by breaking out into small groups to get practitioners talking to one another about what they learned. So it's going to be dynamic, it's going to be fun, it's going to be very practical, and we're going to give people direct links to our Improve and Spark sites so that they can serve as mentors to share what they've developed and learned under these projects, so that we can really transform the field and really improve the lives of families as well as staff and leaders. So that's just a quick snapshot. We're super excited about it. We're grateful for OFA for giving us that platform to be able to highlight the voices. And we just, we hope people will come on the last day and the last afternoon. But if you do, it's going to be really fun and engaging and energetic. So that's what's on tap for tomorrow.
Oh, thank you, Michelle. And let me just say, the energy that Michelle was displaying now is probably about 10% of what it's going to be like tomorrow. So if you join, you'll stay awake, you'll be energized and learn a lot of stuff. So it will definitely be worth your while. Again, thank you to everyone who joined us for this session. I think we have about a 15-minute break at 3 o'clock. Some peer-to-peer engagement conversations occur with various topics that you'll find in the agenda, and I hope you'll join us for that. Thank you all.